Hi everyone, and welcome to a special edition of the Year of You, our Spotlight series. This month we're starting with the question, who do I see? Many people may start with a personal trainer, but there are other specialists like a physical therapist or even an athletic therapist. They all play key roles in helping support our body. If you find this interesting, don't forget to like this video, comment, subscribe, and go to www.drericaandyou.com. Let's jump in. I'm excited to kind of bring this topic to the table. It really sparked something very personal because for me, I always think about physical well-being as important as mental and emotional well-being, especially with me having had a physical injury, something that had me kind of questioning, like, what is wrong with me? And many people kind of have some of those concerns come up and they're always like, wait, who do I talk to? Where do I go? Or sometimes they ignore it. And I laugh because that's what I did for a while. I would muster through the pain and let it go. And so with that, I'm kind of following up on the last newsletter, which talked about mobility, and I wanted to kind of enhance that same theme and continue with talking about physical well-being and really talk to the experts. I definitely have a lot of fun with doing physical well-being by working out, and I enjoy that. But I love talking to people who have that knowledge and expertise when it comes to physical well-being. And so I've brought two individuals here that are going to provide and increase us with that information. And so with that, we're going to be talking about AT versus PT versus personal trainers. And so we're going to try to demystify any kind of confusion or clarify some information that maybe some people are not aware of. And so I would like to I would love for the people to introduce themselves. And so we can start with Miss Khadijah Williams to go first and introduce themselves.
Hello, thank you for having me on. This is great. Just kind of sharing everything. I am an athletic trainer, licensed and certified, and I have been an athletic trainer for about 5 years now, working in the outpatient setting, whether that be an orthopedic as well as industrial setting.
Thank you.
Hi, thank you for having me. This is really fun. My name is Julia, and I am an LPC licensed, and then I'm also a CrossFit Level 2 coach.
Thank you so much for kind of giving us an idea as far as your backgrounds. But, you know, what's really helpful is that, as I mentioned, the letters behind the names is great, but it still is not always clear to know, like, what does that really mean when you have the letters behind your names, or when people say, okay, you're an athletic trainer. Okay, wait, you mean personal trainer, right? or wait, you mean physical therapist? Like, what? So, Khadijah Williams, can you please clarify what is a license? Because you even said licensed athletic trainer. Please tell me what all these letters behind your name mean.
Yeah, so licensed athletic trainer, that is an additional credential. Really the basis of what you need as an athletic trainer is the certification. The certification comes from when you take your boards, where you have the whole exam and to credentialify yourself, right? And so with licensure, you have to go through the state, and that also just gives you additional accreditation with employment. So the basis is the certification. When you see certified athletic training, that means they passed the exam and you can see them as an athletic trainer. Licensure, that's just the additional thing to just give you additional accreditation.
To be fair, I'm not sure I've seen as many athletic. I always think of athletic trainer at a university where you're working with athletes. Where would you see an athletic trainer?
You can see them in a lot of different settings. Primarily it is in the school setting, working with athletes. I mean, it's in the name, right? Athletic trainer, athletes. You're primarily working with athletes. But that can range from middle school, can range from high school, collegiate, professional. They're primarily on the sidelines working with these athletes to prevent, do emergency care, things like that. But It's also very broad to where you can work in an outpatient setting. So that's at a physician's office, that's at a physical therapy clinic, that's industrial working. So it is very broad, but primarily like the basis is with athletes in the school athletic setting. They do go hand in hand, especially in like the physical therapy clinic setting, also industrial setting. Like in the industrial setting, you can be a physical therapy assistant and an athletic trainer to be an injury, and a physical therapist to be an injury preventional specialist. They can work hand in hand with that and work on the same patients and provide the same treatment, things like that. They just can't diagnose, right? Where in the PT clinic, it's nice to be able to have an AT, an athletic trainer, with you, because you can all have these fancy tools like electrical stimulation and compression devices to help with swelling and icing and things like that. So you have to be creative, especially with your rehab. So to be creative, it's using different tools within the office, rolling out, whether that be on like a tennis ball rather than using like an actual ball that's meant for rolling out. So having the creativeness in the PT clinic, you can help with like athletes, and also manipulation too. I will also add, you can't really manipulate. So if someone is having some lumbar pain and they're needing an adjustment, athletic trainers, that's out of the scope of our practice. Physical therapists, that's within their scope of practice. So if they're needing adjustment like that, you are wanting to refer that out. It's like a chiropractor, right? You want to see these specific special professionals to get this done. So it's, you go hand in hand, but it's very different. And like also like with some dysfunctions that you're born with, like congenital dysfunctions like cerebral palsy or spina bifida, athletic trainer, we're not going to really see that, because again, it's very complex. It's a whole thing that you need to know like the protocols with that. That is also something that a physical therapist is specifically you're going to be seen for. Not really athletic training. It's very concise, I guess you could say, whereas with physical therapy, it's a little bit more complex, a little bit more broad. They see a lot more different dysfunctions rather than like something that you see specifically at a sporting event, which is like a sprain. Your finger gets jammed into a basketball, or your toe hyperextends on the field, the turf field, right? So they're going to help with that. It's minor stuff, not more of those more complex and bigger areas and problems.
So even though the name athletic trainer is in your title, you are not always working with athletes. True.
Right.
And the concept is that personal therapist, physical therapist, and the athletic trainers work hand in hand, but more or less the athletic trainers are more from the rehab standpoint. And so we have to think about like the rehab.
Right, and prevention too. We're not just doing rehab, we're doing prevention at a sporting event, whether that be they're having a cardiac arrest, or they're having some allergic reaction, or they're having a diabetic episode. We're doing those on the sidelines. We're treating those emergency responses. So we can keep them where it's not fatal, right? It could be fatal if we weren't there, but we can keep them to where they're getting treatment, and then we'll refer them and get like an EMS, right? Where they can get an ambulance and then go to the hospital and treatment. And same with like if they're on the field, like you've seen it with the football injuries where a football player goes down and they're on a stretcher and they're having to get mobilized to the neck. Like an athletic trainer, they're going to treat that. They're going to see, oh, there might be something going on with your spine. We don't want to further this possible injury, so we're going to prevent it from getting it worse. We're going to splint it, and then we're going to get you to the hospital so you can get further treatment and further diagnosing, right? So it's a lot of things: prevention, diagnosing, and rehab. it goes all hand in hand.